You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. Hey, Evan, it's Dr. J. What's going on, man?
Hey, not much. I'm excited I got to talk with you this week. I was curious if we were going to get together and do this thing. I was like, oh, man, I need my weekly dose of inspiration. So glad we're getting to do this.
Vice versa. I always enjoy talking to you as well. What'd you have for breakfast?
I woke up and my wife said, hey, I made some sausage for you. So it was just some of the Applegate, no hormones, no antibiotics sausage links. Had about 5 of those puppies and just some lemon water. And that's it so far. And I'm still feeling good. And that was a couple hours ago.
Nice. Yeah, myself, I did a great little green drink. So I took some celery and some parsley, took a whole lemon, 1 carrot, some kale, a cucumber, and about 3 or 4 ginger cloves, and I had them all juiced up. About a nice coffee mug size. I drank that. Had some coffee, butter, and MCT oil all blended up, and then I'm also sipping on a whey protein shake. So I got a lot of micronutrients in my green drink. I got some good fats in my butter and MCT coffee, and then I got some extra protein and amino acids in my grass-fed whey protein.
That shake sounds pretty potent.
It was very spicy with the ginger. I love ginger. I mean, ginger is phenomenal. I have it part of my programs with any gut-killing program because ginger is very anti-inflammatory. It's a prokinetic, so people that have delayed gastric emptying or digestive issues, and it also keeps the lymphatic system moving. It's an anticoagulant, so people get inflamed. Things move in the body much slower from a lymphatic and detox perspective, so keeping the ginger in there really keeps things moving.
Ah, that makes sense. Yeah, and I've had some ginger kombuchas.
Love those.
Homemade. I've had some of the ones that are in the bottles, but I've had a couple like homemade ones at some health fairs, and it's enough to make you squint your eyes after you drink it.
Yeah, I was quite hot after I drank it.
Yeah.
So that's what I had. I'm actually heading to Kansas City this weekend. What are you up to?
I don't know yet. I know I'm going to be here in town. My buddy Matt was in town last weekend from Charlotte, so I think I'm just going to do a rest and relaxation, engage my parasympathetic mode all weekend.
Very cool. Very cool. We talked again pre-show. We wanted to talk about gut bugs a little bit, and I've done a lot of shows and posts on parasites and gut bugs. Again, we'll try to look at it from a different perspective, so anyone that's listened to our old stuff, it won't be repetitive. And again, we want to have people walk away with some, take-home application. But I see a lot of people with gut bugs and gut infections, and they don't even have any digestive symptoms at all. They have no diarrhea, no bloating, no gas, no constipation, no reflux, none of that stuff. But on the test, we find gut infections, sometimes even multiple gut infections.
So where do these things come from? I mean, when I first hear that, I think of people traveling to a tropical place, but I know that's not necessary to get a gut bug.
Yeah. So I'll give you, for instance, I had a patient who can go back in time to, let's say, the mid-2000s when this person was in Brazil, and they noticed they got sick and things weren't quite the same. had gone to multiple different GI docs after the fact, and nothing came back. Now, this person's main symptom, and they had some digestive symptoms, but their number one symptom was fatigue. So we ran some tests. We did some of our functional, more specialty labs. And this is kind of where it gets hairy, because I have a lot of people that come in that have digestive issues, and they say, hey, I've gotten my conventional blood work done or my conventional stool test at my local hospital done, and I did not come back with an infection. Let's not go this route. And I say, oh, I've done this thousands of times. I've had this conversation like it's Groundhog's Day, right? And I've seen people come back with infections where they've already been tested by their conventional labs and hospitals, and they come back negative there, but they come back positive on mine. So moral of the story, this guy that had the chronic fatigue came back with a couple different infections, and we were able to catch it on the test. Just starting to treat the infection, his fatigue started getting better. Now, if we just relied on the conventional setting, we never would have even got the info to know that this person had a major infection. And conventional medicine doesn't look at these infections of even existing in a chronic state. Infections are acute. You have diarrhea. You have, all of the traveler's diarrhea, things like that, maybe even throwing up. And once that's gone, that's it. You're over the infection. That's kind of the mindset.
Yeah, and the problem is, even if the conventional model were able to identify it, they're not going to be able to properly address it with some of the things that we may talk about today as the treatment options, for lack of a better term.
Yeah, so there's an antibiotic out there called metronidazole or Flagyl, and we run a specific genetic stool test, and we find a lot of people that come back with infections are also resistant to that antibiotic. I see it all the time. So your typical doctor's going to just prescribe Flagyl and say, hey, here you go, infection be gone. But I see a lot of my stool tests that this comes back resistant. Now, before I even was doing genetic testing for antibiotic sensitivity, I already intuitively noticed that a lot of people were being treated with Flagyl and metronidazole and tinidazole and other antibiotics like this, and they weren't working, like meaning the person would feel a little bit better for a bit of time, and then the symptoms would come back. So I knew intuitively something wasn't right. And then now with some of this newer technology, we can see that there's actually antibiotic resistance. So that kind of makes sense. My intuition was kind of proven right. And that's why a combination of herbs specific to what the infection may be is going to be the optimal way to knock out the gut bug.
Yep. So let's dig a little deeper. Where do these things come from? You mentioned the Brazil case. That's definitely interesting. But say somebody that's not traveling internationally, where are they going to pick these things up, or how are they going to get into the system and allow to become problematic?
Great question. So a lot of these infections are just opportunistic, right? There needs to be some level of immune stress, adrenal stress in that person's life for these infections to kind of take foothold. That's kind of one scenario. Scenario number two is you just get exposed to a lot of that parasite or a lot of that infection, and the bolus, the amount of that infection that's there is just overwhelming to the system to begin with. So it's typically either a small amount where the body is just not able to handle it because of chronic stress, a large amount that really overwhelms the body, and typically one or two tends to be kind of, in effect. And then most of the time people go to their conventional doctor and it doesn't come up for all the many reasons that we talked about. So reason number one, chronic stress. Their immune system is somewhat compromised to begin with. And then number two, there's just a very large amount of the infection there. And then what tends to happen is the infection starts to compromise the body's ability to break down food. So then we have stress in the gut. The first thing that happens when our sympathetic nervous system starts activating is an inability to secrete hydrochloric acid. Hydrochloric acid is needed for protein digestion. HCl for short is what activates our proteolytic, right? Remember, medicine uses big words to make you confused. Protein, lytic, cutting or breakdown. So it activates your proteolytic or protein breaking down enzymes called pepsin in the stomach. The nice low pH of all of that acidic chyme. Chyme is just mixed up food. Take the food, put it in the blender. That's chyme. When that food comes out that stomach into the small intestine, that nice low pH does two things. It causes a stimulation or secretion of cholecystokinin, which causes the gallbladder to contract and produce bile salts or stimulate the release of bile salts. And that CCK also causes the pancreas to produce a whole bunch of lipase, which breaks down fat, right? The LIP, right? Lipid, that's the fat abbreviation. And then it also stimulates the pancreas to produce some proteolytic enzymes, trypsin, chymotrypsin, etc. So we have this whole digestive domino rally effect here. And when the gut becomes inflamed, when there's stress in the gut, one of the first things that gets compromised is hydrochloric acid secretion. And once HCl secretion gets compromised, enzyme secretion gets compromised, bile salt secretion gets compromised, and then foods tend to sit and rot and ferment and putrefy and rancidify, creating more stress. So it's this downward spiral cycle, and then over time the gut lining becomes thinner and thinner, leaky gut starts occurring, more and more food allergies start occurring, and then the patient's symptoms get worse and worse and worse over time.
Okay. So you kind of answered that in a long-winded way, which is good. So
Sorry
basically,
about that.
that's all good. So what I pulled from that, if you're struggling with adrenal stress, which I'd say 9 times out of 10 when we run an adrenal test, somebody is struggling, modern life syndrome. So that's one thing. So then it sounds like with the stress and the combination of the things that are happening from that stress, the lowering of the stomach acid, you can just become more susceptible to these things. So maybe you are exposed to some pathogens in your food and things like that, but they just have a lot easier time of, for lack of a better word, implanting themselves into your system. Is that what you're saying?
Absolutely. And again, these pathogens can come from food, can come from water, like Cryptosporidium and Giardia can easily be transferred in water. They come in food because the person may be handling that food, had some stool or some fecal particles on their hand they didn't wash well enough, etc., or got some stool under their fingernail. And then also, yeah, I know, right? That really takes your appetite to another level. And then the other connection there is intercourse, right? Sexual intimacy is going to be a big way that these things can be spread.
You can spread gut bugs.
You can spread gut bugs. And then also there's another level of sensitivity even beyond that where things like H. pylori can even be spread via saliva. So even interactions that are non-intimate, right? If you have a compromised gut issue and you're sharing a drink with someone or you're giving your child a kiss on the cheek or on the lips, non-intimate stuff, you could still potentially spread these infections, especially if they have any type of compromised gut activity.
Yeah, and something you kind of alluded to already is that if you're under the chronic stress, you're going to have a lowered immune system. So maybe we could talk a little bit about how immune system, the gut health immune system, how all that stuff, when that's compromised, you're at even more risk of struggling with these gut bugs.
Yeah, so it's really a 5-step process, right? There's some type of stress or adrenal stress that's happening that compromises the immune system, right? Exposure to infectious material occurs, right? Lower HCl, lower enzymes, food sits and rots and putrefies and ferments. Food allergies start to get worse. Leaky gut gets worse. The immune system starts becoming more and more compromised. So again, the immune system gets compromised a couple of ways because as the gut becomes more and more inflamed, 60 to 70% of the immune system lives in the gut. So if your immune system is constantly being revved up because of inflammation in the gut and because of foods coming in, because foods aren't being broken down, and because food allergens are constantly there, lots of gluten, dairy, grains, legumes, things like that, refined sugar, again, your immune system will be constantly hyper responsive. That's why if you start getting allergies, the reason why you're getting allergies is because your immune system is so hyper responsive, so upregulated and sensitive, it's responding to anything and everything. I mean, you may see it with like someone that comes back from a war-torn area, like a veteran, and they have PTSD, just the little noise that may happen with like just activity out in the front yard, a car driving by may cause that, veteran to be kind of like, perk up and really get, hyper responsive, right? Because they're used to maybe bombs going off and guns being fired. They're just very hyper responsive. So kind of like this PTSD veteran, our immune system is kind of very much similar to that. It's in this war-torn environment, and it's responding now to dander and to pollen and cedar, and it's like it shouldn't be responding that way. So one of the big things we see with gut issues and adrenal issues is we see allergies as well, and that's part of this whole immune stress sequelae of symptoms.
Yeah, and the drug companies, if I can harp on them for a little bit, they love that people have messed up guts and parasites and all of that.
Absolutely.
A lot of money made on Claritin and all of those other things that have now become over the counter for people. I have a deficiency. I'm just going to squirt it up my nose and fix everything.
Yeah, I mean, if you understand the mechanisms of how these drugs work, you can clearly see that none of the underlying root causes of these health issues are being addressed. So like, I'll just roll through a couple of the allergy medications like Zyrtec or different corticosteroid pills and such. For the most part, they work through either an antihistamine activation, where they're decreasing histamine, and histamine's a neurotransmitter that's produced, especially in the gut under inflammatory environments. Or number two, it's giving you corticosteroids like cortisol or synthetic cortisol. And the reason why that's happening is because your body's been under so much stress that your adrenals aren't able to keep up with the output of cortisol to keep the fire in your body out. So because cortisol is low, because your adrenals are dysfunctional, HPA axis issues, right? The brain and the adrenals aren't communicating, cortisol is lower, and cortisol is like your natural fire hose. Again, in higher amounts, it can be a problem. In lower amounts, it can also be a problem because we have these little mini fires that happen in our body, and if that cortisol is not able to come out and put out that fire, fires can smolder and just continue to create inflammation and create all these other symptoms that now spin off, like allergies and skin issues as well.
You know, that actually really helps me because I didn't connect the dots. I had a woman who I had seen struggling in the gym. Her performance was decreasing. She was doing CrossFit way too much. So I'm not a fan of 6 days a week anyway of CrossFit, but so I had her back down a little bit and I just added in some adaptogens. And she told me that her allergies, her nose was in her head and all of this, like, I don't know, what you call it, stress headaches, allergy headaches here in the front of the skull.
Yeah.
They disappeared after starting the adaptogen. So I never even made the connection there that I may have been taking a little bit of load off the adrenals there, therefore helping the immune system and that healthy histamine response.
Yeah, and we see that all the time. When we get people on an adrenal program, we see allergies significantly decrease. When we also get people on therapeutic levels of hydrochloric acid and enzymes, we also see allergies go away. It's like we're not even touching antihistamines. We're not even touching corticosteroids, in the way that conventional medicine does. We're not doing things to cover things up. We're just addressing the parts of that patient's physiology that aren't working optimally, and we're helping to upregulate it so it works better, while at the same time we're pulling away all of the diet and lifestyle impediments that got them there in the first place.
Right. So let's talk a couple minutes about the things that need to be in place. Obviously, treatment protocols are going to be different for every potential patient listening, so we can't go too deep into that, but there are some generalities that are going to help mostly everyone. So we talked about enzymes, we talked about hydrochloric acid, starting with digestion, maybe a little bit of immune stuff. I really enjoy reishi. I'm sure you'll smile and talk a little bit more about reishi. What else would you like to mention?
So enzymes and HCl are going to be really important. Now, depending on how you respond to enzymes and HCl, let's say 1 or 2 HCLs create irritation or warmness in the tummy, that automatically tells me your gut lining is now very thinned out. So if you have a response where you're feeling warm at just 1 or 2 caps of HCl, I'm now concerned that your issues have been so chronic that your gut lining has been thinned, and you may need extra nutrients to help start supporting and healing that gut lining. So that's number one. Now, depending on what the infection is, may affect things differently. Like H. pylori, we know, is going to affect more of the stomach and the upper part of the small intestine, where some of these other parasites may be deeper into the small intestine. And then things like SIBO may be handled a little bit differently. Chronic fungal infections. It's very rare, in my opinion, that a chronic fungal infection is the root cause. There almost always is a chronic fungal infection that's exacerbated by a deeper parasitic infection or a deeper H. pylori infection. Again, sometimes we see just a pure fungal issue being the underlying cause, but a lot of times they come together kind of brother and sister with a parasite or a bacterial infection combined.
Mm-hmm. So no Lamisil needed.
Well, I mean, like these medications can be really stressful on the liver. Sometimes they can be helpful for topical stuff, just because when we do some of the herbs, it's hard for the herbs to get to the skin or get to the toenail. But we'll try essential oils like tea tree or melaleuca and oil of oregano topically first. We'll do fungal foot soaks for the toenail and stuff first. We always want to exacerbate those first, those options first, before we go to any of the real stressful kind of liver stressing enzymes. I'm sorry, the liver enzyme stressing medications, if you will.
Mm-hmm. Makes sense. Well,
so
cool.
in summary, we have a couple different infections. We have parasitic infections like crypto and giardia and Entamoeba histolytica and blastocystis hominis and Dientamoeba hartmanni, Dientamoeba fragilis. The list goes on, right? So these are some of our bigger infections. We also have infections like your chronic fungal issues, whether it's Candida albicans or Aspergillus or the Rhodotorula species, et cetera. And then we have our bacterial overgrowth, whether it's Enterobacter or Proteus or, let's see, we can go down the list here. Just your general small intestinal bacterial overgrowth, Escherichia coli, Klebsiella, et cetera. These could be our bacteria, these could be our fungal, these could be our parasitic infections. And it's helpful to know what infection we're dealing with, because how we structure a treatment program and what type of other support we put around it can be very helpful.
Mm-hmm.
So we know like berberines are very helpful for SIBO. We know parasitic infections, we really want to go up on the oil of oregano and wormwood. If we see bacterial infections like H. pylori, we may use things like mastica and other healing and soothing herbs to help that part of the infection. If we see viral issues like Epstein-Barr or cytomegalovirus, which can also affect leaky gut, we may use things like monolauric acid, or we may use reishi or cat's claw or even silver. So it's helpful to know what kind of infection we're dealing with so we can really periodize a program that addresses it. And I see a lot of people with, a lot of these infections, and one of the most difficult things people have to wrap their head around is sometimes when we retest, we actually see new infections come up on the lab. So it's like they had like maybe blasto. We then treat the infection for 60 days. We retest, and then blasto is gone, but now crypto's there. And this is kind of weird. Well, essentially infections kind of work their way proximal to distal in the gut lining. So they can burrow in deep, and as the gut heals from the inside of the gut to the outside of the gut, these infections that we're hiding now kind of come to the surface as that gut material starts healing. So sometimes we can see new infections come up. Now, I'll just talk about my wife for an example. When I first treated her many years ago, she had blasto. We then treated blasto. She came back with H. pylori, retested, treated H. pylori. She came back with crypto, retested. She came back with Enterobius formicularis, a worm infection. Now, she had IBS for over 15 years. Now, she does not have IBS now. A lot of her IBS, I should say all of her IBS, was primarily from food intolerances, low stomach acid, and a compounding effect of multiple chronic infections.
Incredible. Yeah. So, well, I'll talk about my wife too real quick then. The cytomegalovirus that we found.
Yep.
Now the cat's claw that she's been taking along with the reishi, all the symptoms are gone. She was having crazy symptoms that most people would freak out about, joint pain.
I know.
Incredible stiffness. I had to put her bracelet on one day because she was so stiff she couldn't really function to do it. And, she's 25 years old. Now we got this little protocol going, and incredible recovery.
Well, I remember a few months ago when you came to me about this, and we did the testing and we saw it there, and it's like, hey, this is an active viral infection. Let's put her on some of these herbs and nutrients, and it's like, boom, a couple months later, she's better. Now, obviously, we don't ever hinge everything on supplementation. The diet and the lifestyle and the sleep and all that stuff's got to be there first. So if we ever just go to the supplements and we just talk about the supplements, it's always a given. It's always 100% given. The diet and the lifestyle and the stress management, all of that has to be there.
That's true. That's true. Yeah. We just assume that you guys out there listening are starting there, and you're doing all that stuff first, and then now you're ready for the extra step.
Yeah, and we're just saying it here again, just so it's our default template. So that's always going to be our assumed starting point. And we're really just going into the deeper stuff because a lot of our listeners were already on track with that. They really want to go to the next level. So we're just talking about the next level pieces. But make sure you're not so busy looking down the road and you trip over the foundational fundamentals right in front of you.
Totally. Great.
So can we just summarize? Someone's listening to this. Maybe they have some digestive issues. Maybe they have zero digestive issues. Maybe it's just fatigue or brain fog. And they never thought about the gut being a causal factor because they have no digestive symptoms at all. What would you say is kind of like your 3 to 5 point take home?
Well, I'm convinced now the first step is to actually get some testing done. You and I talked about that a little bit before the show. Now I'm going to run some tests on me just to see what's going on, just for curiosity's sake, and see if I can uncover some stuff because my diet's dialed in and I'm still having some mysterious symptoms. So I think that's the starting point for people, definitely making sure that your digestion is good, meaning that even though you don't have a symptom like, gas or bloating, you could still have a symptom that's not really a symptom to most people, just feeling extremely heavy after a meal. I thought that was normal until I fixed my digestion and realized that's not normal to feel like you just ate a bowling ball.
Yep.
And then lastly, just taking the baby steps to support your digestion during this process. Maybe this is a little bit tangential, but I definitely recommend lemon water to everybody. Just doing a little bit of that and 4 to 6 ounces of water before meals just to try to help give a mild support. If you're too early in the game, you're still waiting to pull the trigger on connecting with us to pull some lab tests on you and things like that, then that's a good baby step that I think is safe for most people.
I think that's great. I mean, I think if you got any gut issues or if you have fatigue, let's say the fatigue has gone so far, you definitely want to get the adrenals looked at. If you're concerned that, hey, you've done some stuff already, the gut is the next place to look as well. So yeah, do some of the diet and lifestyle things, lemon water, or you can even do a shot of apple cider vinegar. That's acetic acid before a meal. That can help prime the hydrochloric acid pumps as well. But again, if you're having any of these food allergen issues or any of the brain fog stuff, anytime we see brain, you want to look at the gut. The gut and the brain are intimately connected. Anytime you have brain fog or memory issues, it's almost always connected to brain inflammation because the microglial cells become activated, and that can create brain fog. And there's a lot of research supporting that inflammation in the gut equals inflammation in the brain. So the first step I would recommend is digging a little bit deeper and getting some of these lab tests ordered through me or you. I know my site is justinhealth.com. You can click on the Healthy Living store or do justinhealth.com/shop, and you can order some of these lab tests or just get a consult so we can specifically recommend what tests to get ordered so you know exactly the correct steps to take moving forward.
Yeah, I say the consult's definitely the better step because they need to know, do they need the 401? Do they need the 401h? So yeah, I'd say don't try to tackle this thing by yourself necessarily. It's definitely good to be a quantified self, N equals 1. I'm going to do this thing myself. But at a certain point, you just have to, put your hand out there, and it's not a bad thing to have a partnership with somebody in your health. So.
Yeah, definitely start with the diet and lifestyle changes, incorporate bone broth and things like that. That's a really good starting point. And then see kind of how much results and improvement you get there first, and then take the next step later.
Yep.
All right, Evan, anything else you want to add?
No, that's it.
Hey, man, great chat, and you have a good weekend.
Yeah, you too.
Bye.
Bye.
Got a question for Dr. J? Go to BeyondWellnessRadio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to BeyondWellnessRadio.com.